tonight we're going to cover principles of pharmacology. Okay. Medications are an important intervention to you as an EMT, or if you continue on with your education in EMS, they'll become more important as an advanced EMT or a paramedic. There are a couple of medications that you can use, and we'll talk about the ones that you can use after we get through the basics of pharmacology. If they're used appropriately, what can a medication do for your patient?
Reduce symptoms.
Okay. They can reduce symptoms. What symptoms?
Depending on what you're medicating them for.
Depends on what you're medicating them for.
Speaking over the counter, like a headache, it reduces. You take some Unintended and reduces your headache. A fever, you take some. My child takes ibuprofen.
Okay. So let's say that you are an EMT. What are some of the medications that you can administer or help to administer?
Oral glucose.
Okay. You've got oral glucose. What else?
The inhalers for like asthma.
Okay, so that's called a metered dose inhaler.
Epinephrine.
Epinephrine, good. And we do that in an EpiPen, right?
Mm-hmm.
What else? You're on a roll.
Nitroglycerine.
Nitro, yeah, nitroglycerin. And we can administer nitroglycerin in a couple of different forms. So we'll talk about those forms in a minute. So we've got nitroglycerin. What else?
Activated charcoal.
Activated charcoal.
You read in your book, or you just know this.
I should remember this part.
What else?
That's all I can remember.
You've done a really great job so far. What's a medication that we use that we don't even think of as a medication?
Aspirin.
Aspirin is not the one I was going for, but it is one that you can help with. So I'm going to put that up here too.
Oxygen.
Oxygen. Anything else you can think of? No? All right. So if we're talking about using medications appropriately and we're going to use them to reduce symptoms, what are some of the symptoms that using oral glucose might reduce?
Low blood sugar.
Okay. Is low blood sugar a sign or a symptom?
Or you can measure it.
You can measure it. So what is it?
A sign.
It's a sign. So does oral glucose reduce a symptom?
No.
Actually, it probably can, but it's not going to be the measurement of low blood sugar. What's it going to be?
The dizziness and
Yeah, if your patient is complaining of confusion or dizziness, you can't measure that, can you? No, so you have to take your patient at their word. So they're reporting to you a symptom. Now, if your patient has a slightly altered mental status, so they're not responding to you appropriately, is that a sign or a symptom?
Signs.
It's a sign, right? Because you can tell they're not responding appropriately. You can see it. So then oral glucose would be used to treat that sign. Okay? What symptoms might a metered dose inhaler be used to treat?
Asthma of some sort.
hyperventilation.
Hyperventilation is something we can measure. So is it a sign or a symptom? Okay. And asthma is a condition.
Right. It's
not a symptom. So what symptom might we use a meter dose inhaler to treat? What symptom goes along with both of those things you guys just mentioned?
Hypoxia.
What is it?
Is it hypoxia?
Hypoxia is something that can be measured, right, with your SpO2 monitor. So how about difficulty breathing? Okay. If a patient says, I'm having difficulty breathing, you can sometimes see that they're having difficulty breathing. You can sometimes see that they have an altered level of consciousness. But if you can't physically see that they're having difficulty breathing, but they're reporting it to you, it's a symptom, right? Okay, how about an EpiPen? What symptoms do we use to treat what symptoms do we treat with an EpiPen?
Allergic reactions. So it could be difficulty breathing, something like that.
Hives, rashes.
Okay, are those signs or symptoms?
Aren't those signs because you can see them?
Sometimes it's hard to differentiate between what a sign and a symptom is, okay? So, when we appropriately use medications, we might reduce symptoms or we might reduce the signs. Okay, so medications can be used to reduce the signs and symptoms of whatever your patient is complaining about. One of the things that we talked about when we were dealing with airway the other day was the fact that if you administer low-flow oxygen via nasal cannula, by the way, what's the rate that you can administer oxygen through nasal cannula?
1 to 6 liters.
You can go as low as 1, but in the field we usually do 2 to 6. 1 is usually for someone who's on home maintenance, right? 2 to 6 liters per minute. If you deliver low-flow oxygen to a patient who's nauseated, that helps with their nausea, right? Okay. So oxygen can be used to treat symptoms, or it can also be used to treat signs. A patient that's having difficulty breathing and their SpO2 is at 90%, are we going to give them a higher amount of oxygen? Yep. So it's up to us to decide how much oxygen should we administer and at what is the therapeutic dose. Okay. Part of what the therapeutic dose is has to do with your delivery device. You can put 15 liters through a nasal cannula. Your patient's not going to thank you for that, right? Okay. So when we use medications appropriately, we can reduce our patient's signs and symptoms, which in turn kind of reduces their suffering. It's an important thing. Okay. It is absolutely essential that you have the knowledge and skills to administer or assist in administration of the medications that you are authorized to use. Absolutely essential. Why is it important that you know how and when to administer nitroglycerin, for example? What does nitroglycerin do?
Lowers your blood pressure or dilates your blood vessels.
Yes, nitroglycerin is a vasodilator. Because it's a vasodilator, what does that cause to happen to your blood pressure?
It goes down.
It crashes, right? Your blood pressure crashes because all of a sudden you have a huge container that you weren't expecting to fill. So if you administer nitroglycerin and you don't know when you should or when you shouldn't, you could possibly cause harm to your patient. Since we're talking about blood pressure, what is a contraindication to the use of nitroglycerin when it comes to blood pressure?
Low blood pressure, maybe?
Low blood pressure, that's really good. What qualifies as low?
For an adult?
Pardon?
For an adult?
For an adult, yeah, because we're not going to give nitro to a kid.
Right. Blood pressure is 120/80.
That's normal.
That's normal. So anything
Yep.
beyond, below that realm, isn't it? Of, let's see that. Anything under 80 or, let's say under 80 would be considered low, right?
Under 100 systolic. Okay, so if you measure a patient's blood pressure and it's under 100 systolic, you can't give them nitroglycerin. What's funny is that my blood pressure, my normal blood pressure, regularly measures in the mid-90s. My systolic is regularly in the mid-90s. So I would have a constant contraindication to nitroglycerin, right? If you didn't know that you couldn't administer nitroglycerin to a patient who has a blood pressure, a systolic blood pressure of 100 or less, you could cause your patient harm. So it's absolutely essential that you know what the indications and contraindications are to each of the medications that you're allowed to use. All right? Okay, let's figure out, let's define some things. What is pharmacology?
Science of drugs.
Doesn't stop there.
Including their ingredients, preparation, uses, and actions on the body.
Including their ingredients, preparation.
Uses, and actions on the body.
Why do I care if you know what pharmacology is? Because the textbook tells me I have to care?
Probably should know all of those ingredients, preparation, uses, and actions on the body. Sure.
You probably should, at the very least, know what the actions on the body are, right? You should probably know how it's used and why it's used. You might not know how it's prepared. You might not care how it's prepared. But its preparation is going to help you figure out the route of administration. Is the route of administration for a spray different than the route of administration for a capsule? Probably. Maybe not. I mean, maybe not. Maybe we have a tablet and a spray. Nitrostat and whatever the other one is for nitroglycerin. One of them's a spray, one of them's a tablet. We administer nitroglycerin sublingually either way, right? So the route of administration isn't different, but the way that they were prepared is different. Okay? Okay, what is a medication? Don't worry, I'll write it whether you say it or not.
It's a substance that is used to treat or prevent disease or relieve pain.
Substance that is used to treat or prevent disease or relieve pain. What's the difference? We had this conversation briefly, right? A couple weeks ago we had a conversation about what the difference is between a drug and a medication. What's the difference between a drug and a medication?
Let's see the definition.
You're not going to find it in your textbook.
See the
Sorry.
definition of drug.
Mariah, what's the difference between a drug and a medication? Give me your opinion. This has nothing to do with fact. I want your opinion. What's the difference between a drug and a medication?
Medication is designed to help you.
Medication is designed to help you? Okay. What kind of help? Let's make a handy dandy little list over here. Medication, characteristics of medications, characteristics of drugs. Okay, medication is designed to help you. What's the difference between a drug and a medication, Jared?
Generally, medication is more prescribed.
Controlled.
Yeah, a little more controlled.
Controlled. Okay? Your turn, Dusty.
Are we talking about illegal drugs? I mean,
You tell me the difference between a drug and a medication.
I think Okay, medication would be prescribed by a doctor.
Okay? Does that mean that ibuprofen is not a medication?
That's an over-the-counter medication. Let's see. How do I see this? Medication is prescribed by a doctor and can be used with or without a prescription.
Prescribed by a doctor but can be used with or without a prescription?
Right. So
Is that an
ibuprofen you don't
oxymoron?
need- No, ibuprofen you don't need a prescription.
But it's also not prescribed by a doctor. I mean, I didn't just call a doctor and say I've got a
Drugs
headache.
that, medications that are prescribed as well as legal substances used.
Okay, so in order for it to be a medication, it has to be legal?
Well, not necessarily, because in some states, marijuana is legal and it's not necessarily a medication.
Okay, what would make it a drug instead of a medication?
People use it recreationally.
People use it recreationally? Okay, so let me ask you this question. I have 5 325 Norcos sitting in my drawer at home. Okay, it's a prescribed painkiller, right? It was prescribed to me because I had knee surgery and that was what my doctor thought would help me get through the pain after my knee surgery. I've got it left over. It was designed to help me. It is controlled, well controlled. It's a prescription that you have to sign for, right? It's legal. My knee surgery was 2.5 years ago. If I use it today, is it still a medication or is it a drug?
It's a drug,
Why?
because it's the way you're using it
Okay,
for recreation.
so maybe the difference is how you're using it? So what makes it so that I can't use it now? Let's say my knee's bothering me again. If I'm using it because my knee is bothering me from my surgery, is it still a medication or is it a drug?
Do prescriptions have
It could be expired and then
Could be expired.
it could affect you differently because it's expired.
Okay, so is it still a medication or is it a drug?
at this point?
If I'm using it because my physician prescribed it to me, even though, it was 2 years ago, he gave it to me for my knee pain.
But he gave it to you for knee pain after the surgery, not your knee
I'm
pain.
after surgery.
Are you taking it out for your knee or just because you've had a
I'm
rough
taking it
day?
for my knee.
Oh, okay. In my opinion, it's still legal because it's your prescription.
It's my prescription.
That's my opinion. And you're
What if I
taking
take it
what
for
was
my
prescribed.
migraine?
It's not its intended purpose.
It's not its intended purpose, but it is my prescription.
It is.
Let's go back to marijuana. Let's talk about marijuana a little bit. In the state of Colorado, is marijuana a medication or a drug?
Both, because people use it for, some people get it prescribed by their doctor and some people just use it recreationally,
How can it be both?
because it can be.
How? What's the purpose of this conversation?
Awareness. Just to be aware,
So you
probably.
can confuse us.
For me to confuse you? No, the purpose is not to confuse you, but the purpose is to blur these lines. Okay? This isn't as clear cut as people might think it is. It's not. There's no easy answer as to what constitutes a medication and what constitutes a drug. Okay? We have children who are, not in Idaho because it's still not legal, but we have children who are trying to take that cannabinoid oil or whatever, right? Cannabinoid? No, it's not called cannabis because it's just the specific compound in it. Anyway, children take that, and if it's prescribed to them, is it a medication or a drug?
Medication.
Why? If somebody else were to do it, it would be a drug. It's the same thing. Okay? It's all about your perception. Do I care whether or not something is a medication or a drug? Do I care how you see something? If you think it's a medication or a drug, does it matter to me how you see it?
No.
If you were my partner, would it matter to me?
Probably.
Probably. Why doesn't it matter to me as your teacher? Because I'm crazy? No, that's not the right answer. Think so.
Because for the most part, it's opinion-based.
It's opinion-based. There's not one, none of the things that we listed there were factual enough to define the difference between a medication or a drug. If I was 10 days post knee surgery and I took what was left of my bottle of hydrocodone, Norco, I have 20 pills left and I took all of them at the same time, is it a medication or a drug?
Might be under the realm of drug.
Might be under the realm of drug, I'd probably be dead. Right? Would it matter if you considered it to be a drug or a medication when you came to treat me?
No, because when you're dealing with something like that, your opinion doesn't matter.
Your opinion shouldn't matter, right? It might matter if you think if you have in your own biased mind, you have an opinion of someone who overdoses as someone who doesn't deserve to be here. Or you tried to take your own life, so why would I help you? You overdosed on drugs. Why would I help you? They didn't really overdose on drugs, did they? They took all 20 of them? Sure, it wasn't the intent. That's not what they were supposed to do. But it was a medication. It was prescribed to them. So the goal here is to blur lines. Drugs and medications, there's no clear-cut answer as to what is and what isn't. Okay. All right, what is pharmacodynamics?
The process by which medication works on the body.
Thank you. Okay, pharmacodynamics is the process by which medication works on the body. When we're dealing with pharmacodynamics, there are really only two things there are really only two ways that medication can work on the body. They operate as either an agonist or an antagonist. What is an agonist?
How's the stimulation of receptors?
Yeah, so an agonist is a stimulator or a stimulant. Okay, so the receptors where your body receives messages or sends messages, or the receptors within your body, they're either stimulated or depressed, okay, based on the type of medication. So an agonist is a stimulant. What's an antagonist? That means a stimulant, by the way, means that it causes your receptors to work better, faster, more. What is an antagonist?
Are you a suppressant?
Yeah, it's a depressant, right? It causes your receptors not to work as well. So it binds to a receptor and blocks it from receiving a chemical message. Okay, what is a dose?
The amount you give.
And what is the dose based off of?
Sometimes how big the person is.
Okay, so patient's weight. What else?
Age.
Age. And last but not least,
Gender?
nope.
Manner at all? No.
Your desired effect. What you want to have happen. can you give nitroglycerin?
I think is it 2 you can give? But I don't remember how long it has to be.
Hours, that's right.
It's a very short span of time, actually. You can give up to 3 doses, at least 5 minutes apart. If our goal for nitroglycerin is to keep our patient from having chest pain, our desired effect is to keep them from having chest pain, we still have to check our patient's blood pressure, right? Because we can't give them nitroglycerin if their systolic pressure is below 100. Good. We can't give them nitroglycerin if their systolic pressure is below 100. But we want it to work on their chest pain. So we're going to check their chest pain before we give them another dose. And then again, before we give them a 3rd dose, we're going to touch base with them and see if it's having any effect at all.
But shouldn't we check their blood pressure too?
Yeah, absolutely. You should check their blood pressure before every time you administer it. If they see relief after the first dose, are you going to give them another one? No. So the dosage is based upon the desired effect. All right, what is an action?
Intended effect.
Okay, that's what you want it to do, okay? It's a therapeutic effect. What is an indication?
The reason you're giving it?
Yeah, why you would give a medication. Why are we going to give our patient nitroglycerin?
Chest pain.
Chest pain. Okay, what's a contraindication? We talked about contraindications when we talked about OPAs and NPAs, right? So what is a contraindication?
Why you wouldn't give them medication.
Why you wouldn't? Haha. Try to combine my whys. What is a contraindication of the use of nitroglycerin?
Systolic blood pressure of under 100.
Systolic blood pressure of under 100. What are some other contraindications to the use of nitroglycerin?
No chest pain.
No chest pain. Good. What else?
They're a child.
Pardon?
They're a child.
Age.
They're a child? Okay. What else?
I'm not sure what all it does, so I don't really know. I don't know much about nitroglycerin.
Okay. Nitroglycerin is a vasodilator, right? We covered that. What are some other vasodilators that typically men in their elder years take?
Viagra.
Viagra. Yeah, if they've taken an erectile dysfunction medication within the last 48 hours, that's a contraindication to the use of nitroglycerin. What's another contraindication to the use of nitroglycerin? Head injury. Why would head injury be a contraindication to the use of nitroglycerin? What does nitroglycerin do?
It's going to let the blood flow out quicker.
It's going to let the blood flow out quicker. There's not a whole lot of room in the head for bleeding, so we don't want it to bleed if we can help it. Okay, so contraindication is why you wouldn't give a med. There are absolute contraindications, and those are situations in which you would never give the medication regardless. It's an absolute contraindication. The things that we just talked about with nitroglycerin, most of those are absolute contraindications. Okay? Absolute means no way. No way. Sometimes I wish I wasn't being videoed. Okay, and what is a relative contraindication? And the last thing that I want to talk about with definitions is side effects. What are side effects?
Disease. Something that might happen to you if you do take this med.
Okay, it's something that might happen that isn't the intended effect, but it's probably going to happen anyway. And we have two types of side effects. They are called unintended. I'm pretty sure it's unintended. And untoward. What's an unintended side effect?
Not mean for that to happen.
Okay, they're undesirable,
Undesirable.
but they pose little risk. For example, when you administer nitroglycerin, one of the expected side effects, it's undesirable, but it poses little risk, so it's considered unintended. One of the expected side effects is a headache. Okay, you expect for that to happen. You know it's going to happen. It's not what the medication is administered for. You don't want to give someone a headache, but it is an unintended side effect. What is an untoward side effect?
Those would be harmful.
So an untoward effect is an effect that could be harmful to the patient.